9. Silent signs of pancreatic cancer. Act now to save lives. Imagine walking through a dense fog, with only faint glimmers of light to guide you. Suddenly, a subtle warning signal appears. Easy to dismiss, but potentially life-saving. Pancreatic cancer, often called the silent killer, operates in just this way. Its early symptoms are so subtle, they're frequently mistaken for everyday issues like bloating, fatigue, or aging. With over 50,000 deaths annually in the U.S., surpassing breast cancer in mortality, pancreatic cancer remains one of the deadliest yet least discussed diseases. By the time most people notice something's wrong, the disease has often advanced, leaving limited treatment options. But what if you could catch these warning signs early? Research from Johns Hopkins, 2023, reveals that recognizing just 3 key symptoms can boost early detection chances by up to 68%, offering a fighting chance for survival. If you're over 50 or care for someone who is, this video is for you. We'll dive into the 9 silent signs of pancreatic cancer, equipping you with the knowledge to protect yourself and your loved ones. Watch until the end and take action. Hit like, share, and comment to spread this life-saving message far and wide. 1. Dark yellow or brown urine. One of the earliest signs of pancreatic cancer is dark yellow or brown urine, a seemingly minor detail that can carry a profound warning. The pancreas, nestled deep in the abdomen, produces digestive enzymes and regulates blood sugar, sitting close to the bile duct, a pathway that carries bile from the liver to the intestines to break down fats. When a tumor forms in the pancreas, particularly at its head, it can compress the bile duct, blocking the flow of bilirubin, the yellow compound in bile. Instead of exiting through stool, bilirubin builds up in the blood and is excreted through urine, resulting in a dark yellow, brown, or tea-colored hue. This change often appears before jaundice, a more obvious symptom that typically signals advanced disease. Unlike dehydration, this dark urine persists even with adequate hydration, lasting days or weeks. Many dismiss it as a result of diet, medications, or not drinking enough water, especially older adults who may overlook such changes. Regular health screenings in the U.S. can catch these shifts early, but busy lifestyles often lead to delays in seeking care. This symptom may pair with pale stools or mild skin itching, forming a cluster of clues that demand attention. Spotting dark urine early can lead to timely diagnosis, significantly improving treatment outcomes. If your urine remains unusually dark for more than 2-3 days, despite drinking plenty of water, ask your doctor for a blood test to check bilirubin levels or an abdominal CT scan. Don't let a small bathroom clue slip by unnoticed. 2. Upper abdominal or mid-back pain. Upper abdominal or mid-back pain is a symptom many brush off as indigestion, muscle strain, or simply getting older. This pain feels dull and gnawing, like a deep pressure just below the ribcage or radiating to the mid-back. A pancreatic tumor, especially in the body or tail of the pancreas, presses on nearby nerves and organs, triggering discomfort. The pain may worsen after heavy meals, particularly those high in fat or when lying flat, prompting some to lean forward or curl up for relief. Unlike typical indigestion, it doesn't respond to over-the-counter antacids and tends to persist, often disrupting sleep. Older adults frequently attribute it to arthritis, poor posture, or stress, delaying medical evaluation. Mayo Clinic research highlights that pancreatic cancer-related pain has unique traits. It's deeper, more persistent, and unresponsive to common remedies. This symptom often pairs with fatigue, weight loss, or early satiety, painting a clearer picture of a potential issue. Many try pain relievers or physical therapy, but these only mask the problem. Early detection of this pain can prompt imaging tests that catch cancer before it spreads, vastly improving prognosis. If you experience dull, persistent upper abdominal or mid-back pain for more than 5 to 7 days, especially if it doesn't ease with medication, request an ultrasound, CT, or MRI from your doctor. Don't let familiar discomfort become a deadly oversight. 3. Early satiety. Feeling full after just a few bites, known as early satiety, is a deceptive symptom often dismissed as overeating, stress, or aging. A pancreatic tumor can press on the stomach or small intestine, reducing their ability to expand and signaling fullness prematurely. This sensation may come with bloating, mild nausea, or a tight feeling in the abdomen, even after light meals. Unlike occasional overindulgence, early satiety from pancreatic cancer persists, occurring with small portions and worsening over time. The American Gastroenterological Association notes that 25% of pancreatic cancer patients report early satiety before diagnosis, yet many don't see it as serious. Older adults may chalk it up to acid reflux, irritable bowel syndrome, or dietary changes, especially since digestive shifts are common with age. This symptom often accompanies pale stools, weight loss, or fatigue, forming a critical cluster of warning signs. Some adjust by eating less, thinking it's a stomach issue, but this can lead to malnutrition, weakening the body's resilience. Recognizing early satiety early can trigger diagnostic tests that catch cancer in treatable stages. If you consistently feel full after small meals for over a week, keep a food and symptom diary and ask your doctor for a pancreatic enzyme test or abdominal imaging. Don't let your stomach's early stop signal go unheard. 4. Fatty, pale, or greasy stools. Fatty, pale, or greasy stools, known as steatorrhea, are a direct but often ignored sign due to embarrassment. These stools appear light gray, clay-like, float in the toilet, have a foul odor, and may be hard to flush. The pancreas produces digestive enzymes to break down fats, but a tumor blocking the pancreatic duct or impairing enzyme production prevents fat digestion. Undigested fat passes into the stool, creating a shiny, greasy texture. This reflects a serious disruption in pancreatic function. The American Cancer Society reports that 30% of pancreatic cancer patients notice steatorrhea before diagnosis, but many hesitate to discuss it, assuming it's due to diet or a stomach bug. People often mistake it for food intolerance, like lactose sensitivity or temporary digestive upset. In the U.S., where processed diets are common, such changes may be brushed off as dietary quirks. Steatorrhea often pairs with bloating, early satiety, or weight loss, forming a pattern that warrants scrutiny. It can also impact quality of life, causing anxiety in public restrooms. Early recognition can prompt tests that detect cancer before it advances. If you notice greasy, pale stools for more than 3 to 5 days, especially with other symptoms, request a pancreatic function test and abdominal imaging from your doctor. Don't let discomfort silence a vital clue. 5. Unexplained weight loss and loss of appetite. Unexplained weight loss and loss of appetite are alarming signs, especially when they occur together. Losing 5 to 10% of your body weight in 6 months without trying, for example, 10 to 15 pounds if you weigh 150, is a red flag. Pancreatic cancer causes the body to burn energy faster due to the demands of cancer cells, while inflammation suppresses hunger. Many report a sudden disinterest in food, with favorite dishes losing appeal, or a few bites feeling like a full meal. Tumors block digestive enzymes, impairing nutrient absorption, leading to malnutrition despite normal eating. Initially, weight loss may be praised, with comments like, "You look great," but unintentional loss signals a deeper issue. Older adults often attribute it to aging or stress, delaying medical checks. The American Cancer Society notes that 35% of pancreatic cancer patients experience this before diagnosis. It's commonly mistaken for intentional dieting, thyroid issues, or depression. This symptom often pairs with muscle loss, fatigue, or digestive changes, forming a critical pattern. Early detection can lead to life-saving interventions. If you're losing weight without effort or have no appetite for over a week, request a comprehensive blood panel and pancreatic screening such as a CA-929 test or CT scan. Don't let compliments mask a serious threat. 6. Chronic fatigue and weakness. Chronic fatigue and weakness are symptoms many dismiss as part of a busy life or aging. With pancreatic cancer, this fatigue is unrelenting, persisting despite rest, making simple tasks like walking or cooking feel exhausting. Cancer cells consume vast amounts of energy and nutrients, leaving healthy cells depleted. The body's inflammatory response to the tumor further drains reserves, creating a sense of running on empty. This fatigue often includes mental exhaustion, with feelings of low motivation or anxiety, easily mistaken for stress or burnout. The American Cancer Society reports that 40% of pancreatic cancer patients experience chronic fatigue before diagnosis, yet many don't see it as urgent. Older adults may assume it's normal to feel tired, while others blame work or lack of sleep. This symptom often pairs with weight loss, pain, or appetite changes, signaling a systemic issue. Some turn to caffeine or supplements, but these only mask the problem. Early recognition can prompt tests that catch cancer in treatable stages. If fatigue lasts over 2 weeks and rest doesn't help, ask your doctor to check for inflammation and pancreatic function. Don't let exhaustion become your new normal. 7. Blood clots. Blood clots, such as deep vein thrombosis, DVT, or pulmonary embolism, are unexpected and dangerous signs. Pancreatic cancer increases blood clotting risk, leading to swelling, redness, or pain in the leg, DVT, or sudden shortness of breath, chest pain, and rapid heartbeat if a clot travels to the lungs, pulmonary embolism. Tumors release inflammatory chemicals that disrupt clotting balance, causing clots without obvious triggers like prolonged sitting or surgery. The American Society of Hematology notes that pancreatic cancer is a leading cause of cancer-related clots, with 20% of patients reporting this symptom. Clots are often mistaken for muscle strain, swelling from inactivity, or heart issues, especially in older adults. In the U.S., where sedentary lifestyles are common, such symptoms may be overlooked. Clots can be life-threatening if untreated, making prompt action critical. This symptom may pair with fatigue or weight loss, forming a pattern that demands investigation. Early detection can uncover cancer before it spreads. If you experience leg swelling, pain, or sudden breathing issues, seek emergency care immediately and request cancer screening, particularly for the pancreas. Don't let a sudden threat catch you off guard. 8. New-onset diabetes. New-onset diabetes, especially in people over 50 without weight gain, is a surprising but critical clue. The pancreas produces insulin to regulate blood sugar, but a tumor, particularly in insulin-producing areas, can disrupt this, causing sudden blood sugar spikes and a type 2 diabetes diagnosis, even without family history or typical risk factors like obesity. The National Institutes of Health, 2023, found that 20 to 30% of pancreatic cancer patients were diagnosed with diabetes 1 to 3 years prior, often without weight gain. This is frequently attributed to aging or poor diet, especially in the U.S., where diabetes is prevalent. Unlike typical diabetes, this form may coincide with weight loss, fatigue, or pain, signaling a deeper issue. The pancreas is the body's blood sugar regulator. When compromised, the system falters. Many accept a diabetes diagnosis without further probing, delaying cancer detection. Early recognition can lead to diagnostic imaging that catches cancer early. If you're diagnosed with diabetes after 50, especially with weight loss or other symptoms, ask for a pancreatic CT scan or CA 19-9 test. Don't let a common diagnosis hide a rare danger. 9. Persistent digestive issues. Persistent nausea, vomiting, or digestive discomfort is a sign many endure for weeks before suspecting a serious issue. A pancreatic tumor can block the flow of digestive enzymes, causing food, especially fatty or protein-rich meals, to linger in the stomach, leading to bloating, nausea, or vomiting. This discomfort feels like a constant queasiness or heaviness, even with bland foods. Unlike occasional upset stomachs, these issues don't improve with antacids or dietary changes. The American Gastroenterological Association reports that 35% of pancreatic cancer patients experience persistent digestive problems before diagnosis, yet many assume it's acid reflux or food sensitivities. In the U.S., CTC, where processed diets are common, such symptoms are often dismissed as normal. This issue often pairs with greasy stools, weight loss, or early satiety, forming a critical pattern. Some try probiotics or elimination diets, but these don't address the root cause. Early detection can prompt tests that catch cancer in treatable stages. If digestive discomfort lasts over 10 days, especially without dietary relief, request a pancreatic enzyme test and abdominal imaging. Don't let stomach troubles become a silent alarm. Take action today. Pancreatic cancer is a stealthy foe, but you can outsmart it by recognizing these 9 silent signs early. From dark urine to persistent digestive issues, each symptom is a piece of your health puzzle. Don't let embarrassment, busyness, or the assumption that it's nothing hold you back. If you or a loved one have 2 or more of these symptoms, contact your doctor immediately and request pancreatic screening, such as a CT scan, MRI, or CA-19-9 test. Early detection can boost survival odds from 12% to over 50%. Time is precious. Acting today could save your life. Hit like, share, and comment to spread this vital message to your family and friends. Subscribe for more life-saving health insights. Together, we can raise awareness and protect those we love. Your health is your greatest asset. Seize control now.